This is Akashavani Mangaluru. Dear listeners, tomorrow is October 10, World Mental Health Day. In this connection, we now broadcast a talk, Awareness on Mental Health and Mental Illness, by Ms. Manju Pant, Lecturer, Department of Psychiatric, Mental Health Nursing, Manipal College of Nursing, Manipal Academy of Higher Education, MAHE, Manipal.
Every year, we celebrate World Mental Health Day on 10th October. The theme of 2023, set by the World Federation of Mental Health, is Mental Health is a Universal Human Right. World Mental Health Day is all about raising the awareness of mental health and driving positive changes for everyone's mental health. This year's World Mental Health Day celebration coincides with the 75th anniversary of the foundation of the World Federation of Mental Health in 1948. At its foundation, a range of recommendations were made, including that specifies agencies of the United Nations should do everything possible to coordinate their activities in the interest of developing adequate mental health programs within each member nation, and the World Mental Health Organization (WHO) will give adequate attention to mental health principles in their mental health programs, drawing on international professional organizations for cooperation. This year's themes enables us to redouble our efforts to ensure that everybody should receive quality mental health care and that the human rights and well-being of a people with mental illnesses are respected in all parts of the world, so that every person with a mental difficulty has the right to be protected from known harms of mental health, a universal right which implies to the entire population, but especially for the vulnerable group like children and the displaced people. The second right says that the right to access quality and affordable care when a person is struggling with their mental health. The right to freedom, dignity includes the right of choice. It is also a chance to talk about mental health, how we need to look after it, and how important it is to get help if you are struggling from any mental health illnesses. Mental health is a state of well-being that enables people to cope with the stresses of life, their daily life, realizes their abilities to cope with the problem, to learn well and work well, and to contribute to their community. It's an integral component of health and well-being that underpins our individuals and collective ability to make decisions, build relationships, and shape the world we live in. Mental health is a basic human right. It's crucial to personal, community, and the socio-economic development of our world. Mental health is more than the absence of the mental disorders. It exists on a complex continuum, which is experiencedly different from one person to the next, with varying degree of difficulty and distress and potentially very different social and clinical outcomes. Mental health conditions include mental health disorders and psychological disabilities, as well as the other mental states associated with significant distress, impairments in functioning of a person, or risk of self-harm or others' harm. People with mental health conditions are more likely to experience lower level of mental health well-being, but this is not always or necessarily the case. Mental health is more than just the absence of a mental illness. It includes how you feel about yourself, how you adjust to your life events. The National Mental Health Association says there are different types of characteristics of a mentally healthy people, which includes how they feel about themselves, how they feel good about themselves. They do not become overwhelmed with the emotions such as the fear, the anger, the love, the jealousy, the guilt, the anxiety. They should have a long-lasting and satisfying personal relationship. They should feel comfortable with the others or with themselves. They should laugh. They can laugh with themselves and with others. They have the respect for themselves as well as respect for the others. They are able to accept their life disappointments. They can meet the life's demands and handle their problems when it arises. They make their own decisions. They shape their environment whenever possible and adjust to it when necessary. Mental illness is also called as mental health disorder, which refers to a wide range of mental conditions, disorders that affects one's mood, thinking, or their behavior. For example, there are many mental illnesses including depression, anxiety disorders, schizophrenia, eating disorders, or the addictive or substance use behaviors. Many people have mental health concerns from time to time. Mental health concerns become a mental illness when ongoing signs and symptoms causes frequent stress and affects your ability to function properly. A mental illness can cause a miserable and can cause problem in your daily life. It can be at school, it can be at your workplace, or in your relationship. In most cases, symptoms can be managed with a combination of medications and a talk therapy. There are multiple causes that can make a person to have a mental illness, such as the genetic factors. Certain genes are there that increases the risk of developing a mental illness, and your life situations may trigger it. There are few factors that are environmental factors. Exposure to any of the environmental stresses, any type of inflammatory conditions such as toxins, alcohol, drug, while in the womb can be linked with the mental illnesses of a child. Some neurotransmitters are naturally occurring brain chemicals that carry signals to other parts of our brain or body. When the neural networks involves these chemicals are impaired, the function of our nerve receptors and the nerve system changes and leads to the disorders of emotions or others. There are many factors which make us to be prone to have those disorders. It can be a risk for any of the individuals to develop any sort of mental illness, which includes any history of mental illnesses in their blood relatives, a stressful life situation such as financial problems, a loved one's death, or a divorce. It can be an ongoing chronic medical condition such as diabetes. Brain damages also leads to a serious illnesses or injuries such as traumatic brain injuries, violent blow on the head, or any type of road traffic accidents or hemorrhages. It can be a traumatic experiences. For example, we know about PTSD, that is post-traumatic stress disorders, which is very, very common among the military combats or the assault if it has happened with anyone. Use of alcohol or any type of recreational drugs can be a risk factor for someone to become prone to have any mental illnesses. Anyone had a childhood history of any abuse or neglect. If you have few friends or a very few healthy relationship where you talk very less, or a person who has already a history of mental illnesses can be at a risk of developing any sort of mental illnesses at any point of their life. Mental illnesses are very common. About 1 in 5 adults has a mental illness in a given year. Mental illnesses can begin at any age. It doesn't see any gender, creed, or caste. From childhood through later adult years, but most commonly it begins in the early life. The effect of mental illness can be temporary or it can be lifelong. You also can have more than one mental health disorder at the same time. Now, when we talk about the sign and symptoms, how to recognize that you are suffering from a mental illness or someone in your family or a close one is suffering from some sort of mental illness. You can see how they feel. Are they feeling sad or they feeling very down? Are they confused or their ability to concentrate on any of the activities has reduced down? If a person has excessive fear or worries, or they are guilty or they have extreme feeling of guilty, can be a sign for a person that they are suffering from some sort of mental illness. A person can feel extreme mood changes from a high or lows. They may have withdrawal from their friends and the activities what they used to like earlier. There can be a significant tiredness, low energy, and even problem in sleeping, eating can be seen in the patients or the person who are suffering from mental illnesses. They may have detachment from their reality. They may feel hallucination, they may feel little paranoid or suspicious. These type of people may feel inability to cope with the daily problems or the stress what they have in their life. They may feel trouble in understanding or relating any situation to any of the person. That may lead to the problems of alcohol consumption or the other synthetic drugs consumptions. They may feel the changes in their eating habits, their sexual drives can be changed. The sign can be excessive anger or hostility or the violence can be seen. Sometimes people may feel the suicidal thinking. Sometimes symptoms of a mental health disorders appears as a physical problem, not only as a mental problem, such as they may feel stomach pain, they may have the bodily pain, backache, the headaches, or sometimes some other unexplained aches and pain. Mental illness is a leading cause of disabilities. Not only the causes, the signs, but it leads to the complications. The untreated mental illness can cause severe emotional, behavior, as well as the physical health problems. Sometimes the complications can linked with the mental illnesses, which include unhappiness and decreased enjoyment of their life events or situations. They may have relationship difficulties. They may feel isolated from the society or social isolation can be seen. They may have the increased consumption of the substances or the alcohol. They may have problem in their social, occupational and personal functioning. They miss their work or their schools or the other problems related to their work or the schools. They may have legal and financial problems. Poverty and homelessness also a complication of mental illnesses. Sometimes people with mental illnesses harm themselves or they harm the others. Mental illnesses always lead to the weakened immune system, so your body can have a hard time to resist any type of infections. Heart diseases or the other medical illnesses are also common complications of the mental illnesses. Now the point is to think whether the mental illnesses can be treated. Yes, mental illnesses can be treatable. Most people with mental illnesses recover and live productive and a happy life. Treatment is different for each type of mental illnesses. It can vary according to the individual, how serious the symptoms are. It can also depend upon the person's past history of the illnesses, their medical compliance, and there are n number of treatments, including the psychological therapy. There are different forms of psychotherapies that can be given to the patients who are suffering. Or we can say that talking about the mental illnesses can help out the person to express their emotions and to express their feelings to the therapist or to anyone whom you feel you can share your emotions. There are many therapies such as supportive therapy, the CBT, that is cognitive behavioral therapy, where we basically talk about the emotions of a person, psychodynamic therapy, interpersonal therapy, and the acceptance and the commitment therapy, where the person has to accept the mental illnesses. They should know, the family should know about the mental illnesses, and they should accept the person the way they are. The other therapies can be a group therapy. It can be a couple therapy if they are married, if they have any type of marital conflicts, and the family therapy. So these were the psychological therapy that can be provided to the patient depending upon their mental illnesses. Medicines can be used in the treatment of mental illnesses. If it's anxiety disorder or depressive, yes, antidepressants and anxiolytics can be used. If a person is suffering from mood disorders, then mood stabilizers can be used. For the schizophrenic and psychotic patients, antipsychotic medicines can be used. Not only the medicines, but yes, the changes in their lifestyle also prevents the mental illnesses or also treats the mental illnesses, such as exercises, physical exercises, having a good healthy diet, maintaining a good social contact, and yes, avoiding any sort of illicit drugs or alcohol. There are few complementary therapies also that help the persons who are suffering from mental illnesses. Deep breathing exercises, which relieves the stress, the meditation, sitting in a calm, quiet environment and just thinking about one thing, about their own health. There are many support groups, many NGOs, many governmental organizations also that help the people who are suffering from mental illnesses. Community programs can help with practical aspects of life such as employment, the vocational training, the education and the training and the accommodation of the persons who are suffering from mental illnesses. This can be helpful for the people with mental illnesses in a long term. Sometimes mental illnesses is severe with the risk of suicide. So in that cases, treatment may involve hospital assessment and maybe the admission of the person in the hospital. Yes, there is no sure way to prevent any mental illness. However, taking steps to control stress, to increase your resilience, and to boost low self-esteem may help keep your symptoms under control. So, follow these steps so that you can prevent yourself from the mental illnesses. Always pay attention to your warning signs. Have a good routine medical care. Get help when you need it. You can talk to your friends, you can talk to your family and talk about your health. Not only mental health, but about your medical health too. Take a good care of yourself. Make yourself as a priority. Sufficiently sleep, eat healthy food, do regular exercises. These all are very, very important to prevent you from any sort of mental illnesses. Almost half the population has experienced a mental health disorder at some sort of time in their life. There are many different types of mental illnesses and each type has a different set of symptoms and causes. If you are concerned that you might be experiencing a mental illness, see your doctor or meet a therapist. This is the first step to getting treated and returning to a good mental health. So on this World Mental Health Day, come together with your friends, family or colleagues and talk about their mental health on this Mental Health Day by holding a tea and just talk.
Dear listeners, you have just heard a talk, Awareness on Mental Health and Mental Illness, delivered by Ms. Manju Pant. This talk came to you from the studios of Akashvani Mangaluru.